Hi, I'm Dr. Rajani. Thanks for joining me for Raji's quick clip. Today I'm talking about cheek fillers. I had the question asked, why is everyone getting cheek fillers? Should I be getting cheek fillers? What does it do? They were alluding to the jawline. Does it also lift the jawline, I believe? And can it look unnatural? Should I get the filler in the front? Should I get it in the side, in the high lateral cheek? And how should I get it? What should I get? Cannula needle. It's a Raji's quick clip, so we're going to roll through a few answers and we're going to get started in 3 seconds. So cheek fillers. Fillers really all started in the nasal folds, and that's where the first approvals were. But quickly thereafter, we were doing many areas of what we consider off-label. Cheek fillers came to play mainly, Radius is one of the first, I remember, 2007-ish, 6, 7, changed the name in between there, Radiance, Radius. And then Voluma came along and Restylane Lift, and now we have different cheek fillers. Things like biostimulators, Sculptra can be used. But why is everyone so quick to inject the cheeks? There's a couple reasons. One is, along with the cheek, is really the under eye. And a lot of people want to come in for the under eye because obviously it's a window to the soul, it's thin skin, people get eye bags. By doing the lateral cheek and the front of the cheek, we can address the under eye. And we talk about tear trough, we talk about under eye. But if you think of the zygomatic bone and you touch your hollow beneath the eye or the tear trough, it's on that bone. So it's really part of the mid face because it's in the zone, and there's FDA approval on that. So when companies come in to train people, they can train on the cheeks, on the lips, on the nasal folds. Incidentally, Sculptra is a biostimulator, not a filler per se, but it is approved for the preauricular area, and it's built for that because it goes in as a water and you can blanket. You try and put a filler here and you have to use too much. So that's the cheek area. Now, if you do the cheek and you don't do the temple hollowing is going to look worse. If you do the cheek and you don't do the front of the ear, the preauricular, and you have hollowing, that's going to look worse. You're going to look skeletonized. But those, a lot of times the temple, there's no real FDA approved filler, so people aren't training people on it per se to come into the majority of clinics, and the same thing for the in front of the ear. Most people aren't being trained. But also, people go home and you can use 3 vials of filler and you can see a nice difference. That's put a teaspoon is 5, so it's 3/5 of a teaspoon. You can do in the front and you can do the high lateral cheek and you can see a nice difference. So again, it's like the lips. It doesn't break the bank to treat the area. It's not a movement area. You get longevity. When you fill the cheek, it does pick up the area you fill below it, because if I fill laterally here, I'm going to lift a little along the jaw. If I fill the front here, then it's going to lift up the nasal fold and a little down by the edge of the mouth. So you can see by volumizing, you're getting lift. Be mindful, beauty is angles, and beauty needs to be looked at by your provider and someone that does it every day, because you do too much in the front, you're going to look fat, even if you're thin. Now, thin people might not mind that, because people won't say, well, why aren't you eating? Why are you starving yourself? People don't like that if they're thin. But if you carry a little bit of weight, you might not want much in the front. Conversely, almost everyone loves a high lateral cheek. Beauty, youth, fertility, the high lateral cheek. And it looks good. It's model-like. But when people go home and it lifts the jawline and they get a lot of compliments, they get an extra date or 2, what do you say? Well, I had 1, I think I'll have 2 or 3 more. If 1 was good, 3 more would be perfect. But then all of a sudden you're wide this way, and what happens? The eyes then look inset because the cheeks are full laterally, and the temple and the preauricular look hollow. So it's a balance. It truly is a balance, and having a great provider that looks at all these things and the angles. And then it comes down to, like in my video, Look 10 Years Younger, it's not about filling just cheeks. You can't have new cheeks and an old lip and wrinkles around the mouth. It has to be full face if you're beyond the age of 40, 50, 60 and above, because you don't want to be piecemeal together with new parts in one area and skin not looking new in the other, however you want to word or term it. So that's cheek filler. You have a choice. So a lot of people use Radius, hyaluronic acid filler. Sculptra's great. You don't get that crisp calcium type of border, but you get a nice cheek, and it will build collagen. So a lot of times you don't need neuromodulator or Botox around the eyes anymore because the skin is better. So you don't need to stop the movement. That's cheek filler. Have you had it? What product do you like? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.